this lecture, we will discuss basic cardiac anatomy and circulation. The heart is made up of about 2 to 3 billion cardiomyocytes. It is situated in the center of the chest cavity, sitting at a slight angle directed inferiorly, leftward, and slightly anterior. If you look here, we can see in the image that we have the heart right here in the center of the chest, okay, and it's directed leftward, okay, so going towards the left of the body, okay. It's going inferiorly, so heading inferiorly, as well as in this direction, okay. So if you took the mean axis, you'll see that it's directed in this way, all right? This anterior view of the heart makes it evident that the right ventricle is the most anterior portion of the heart, all right? So if you look here, our right ventricle is actually sitting right here, all right? So it's sitting right over the anterior chest of the cavity. So this is our right ventricle. This would be our right atrium, our left atrium, and our left ventricle. And that's why you see that here. Our right ventricle in this area is sitting on the most anterior, and notice how everything is directed in that direction, okay? The image on the right is a box diagram giving us a basic cross-sectional view of the heart. We'll be using these diagrams throughout some of these lectures because it really makes things easy to visualize what's going on. Again, it's not identical to the normal anatomy of the heart, but again, for our purposes, it works quite well. Now notice the 4 chambers of the heart. There's 2 atria, the right and left atria, and then you have the 2 ventricles, the right ventricle and the left ventricle. So here's our right atrium, in our left atrium, our right ventricle, and our left ventricle. We can also see some arteries and veins here. Remember, veins bring blood to the heart, while arteries take blood away from the heart. Okay, so we're looking at some of those here. We have our IVC, our inferior vena cava, and our superior vena cava bringing blood back to the heart, to the right atrium. And then we also have our vein from our lungs. Okay, so our lungs here will bring blood back to the left side of the heart, to our left atrium, and this is our pulmonary vein, okay? So the pulmonary veins bring blood to the left side of the heart that is oxygenated. Remember, the right side of the heart is bringing venous blood back to it that is deoxygenated. And then we have arteries as well, okay? And those arteries include the pulmonary artery, okay? So our pulmonary artery is here and is bringing blood from the right ventricle out to the lungs, okay? And then we also have the aorta, okay? So our aorta is here, taking blood from the left ventricle out to the rest of the body, okay? So the oxygenated blood would be the blood coming from the lungs, the pulmonary vein, and the aorta. And that carrying deoxygenated blood would be those coming back to the heart, so the inferior vena cava and superior vena cava, as well as the pulmonary artery, okay? So we can think of the heart as a pump consisting of 4 main chambers, the 2 atria and the 2 ventricles, with blood circulating through one closed system. The atria empty into their corresponding ventricles, the right ventricle empties into the pulmonary circulation through the pulmonary artery, and then the left ventricle into peripheral circulation through the aorta. Okay, so let's just take a look at this circulation. So we have blood, we said, coming back from the lower extremities, okay, to our IVC, and then blood from our upper extremity. This is deoxygenated blood coming to the right side of the heart. From our right atrium, it enters through our tricuspid valve, which is here, into the right ventricle. And then from our right ventricle, all right, we go out our pulmonic valve, okay, through our pulmonary artery into the lungs to be oxygenated. And then it comes back to the left side of the heart, oxygenated blood to our left atrium through this mitral valve, into the left ventricle, out our aortic valve through the aorta, okay, into the rest of the body. And we said this is one closed system because blood that comes from the body, okay, so it goes out to the muscles take out that oxygen from the blood, and then that deoxygenated blood comes back to our venous system into the right side of our heart, and this system continues, okay? So from the lungs here, then it goes back, gets oxygenated into the left side of the heart, and you can see this is a one closed system that we have going on here. So let's briefly review what we discussed before we end. So again, the heart, as we've seen, is a 4-chamber pump. And it's made up of 2 atria and 2 ventricles. We said it's made up of 2 to 3 billion cardiomyocytes. So when we say cardiomyocytes, those are actually the muscle cells. That doesn't include fat cells and all the others, okay? So that's 2 to 3 billion. That's quite a bit, okay? Now the location of the heart, we said, is in that center of the chest cavity, okay? We said that is directed inferiorly, leftward and anteriorly, okay? And we'll see that as we look at the electrical conduction system, everything is also heading in that direction as well. The right ventricle is the most anterior portion of the heart. That's important to know. Circulation, we said this is a one closed system. Veins, remember, bring blood to the heart. When we said arteries bring blood away from the heart. Remember, the atria empty into their corresponding ventricles. The right atria into the right ventricle, the left atria into the left ventricle, okay? And remember our circulation from the right atrium to the right ventricle to the pulmonary artery to the lungs to get oxygenated, back to through our pulmonary veins. After it becomes oxygenated to the left side of the heart, we have our left atrium, left ventricle, out our aorta to the rest of the body, and then back to our IVC and superior vena cava, and this whole system then repeats itself. Well, that's the end of this lecture. We discussed basic cardiac anatomy and circulation. I hope you learned something.